now that we know that sickle cell disease is an autosomal recessive gene that is inherited from both parents, what can we do to prevent it? I know the state of North Carolina, most states in the United States, once a child is born, the child's hemoglobin status is tested. So if a child knows that they're AA or AS, or you're planning to get married, you're from African descent, it's always good for one to go have their genotypes tested. And if you're AS, you go to genetic screening and counseling and make sure that your spouse is not AS. Because if the spouse is AS, then chances are that there's a risk, if you're both AS, that there's a risk of you having a sickle cell child. Now, if you and your spouse are both AS and you want to continue or proceed with the relationship to have children, there are things that people do that can check the baby during pregnancy to see if the baby has sickle cell disease. One of these tests is called amniocentesis. It's done about 14 to 16 weeks. And you see here, a needle is placed into the amniotic fluid sac of the mom. And you can get the accuracy, you can test the hemoglobin status of the baby, and it's 99.4% accurate. The chorionic villus sampling is done a little earlier, about 10 to 13 weeks. It's more than 99.5% accurate. And for this, it's the placenta. They check, they go through the cervix and get a piece of the placenta and test that. There's also blood tests where they go to the umbilical cord while the baby is in the mother's womb and test the blood, because the umbilical cord has the baby's blood, to see if the baby has the sickle cell gene, whether the baby is homozygous. Homozygous is when you have two abnormal genes, or heterozygous is for the trait, when they have one normal gene and one abnormal gene. So how else can we prevent? These are ways we can, prevent, babies being born with sickle cell disease. When the babies are born, due to the nature of the illness, they are inherently susceptible to infections. So we recommend that those babies are treated with penicillins up to about 5 years of age. In malaria endemic countries or parts of the world, sickle cell disease, hemoglobin S actually protects against malaria for those who have the trait. But for those who have the disease, when they have two abnormal genes, they don't need the malaria merozoites to make their bloods get broken up. Their blood cells just don't last long enough. So in those patients, they still require malaria prophylaxis. And sickle cell patients, of all patients, actually do need to have their vaccinations and on time.